Welcome to our info webinar on ear acupuncture for animals. We would like to show you our unrivaled approach to diagnosing and treating dogs and horses via the ear. And we would like to introduce you to our online training with the title Ear Acupuncture in Dogs and Horses. Ear acupuncture on animals today is in no way inferior to human ear acupuncture. The full potential is available to you. We are trainers from Auriculo.org, the school for Auriculotherapy and Ear Acupuncture. Our webinar lasts approximately 1 hour. Claudia is our guest. She is a specialist in human and veterinary ear acupuncture. My name is Anja and I will be moderating. First of all, we would like to briefly introduce you to our online school, Auriculo.org. How does the online training work and what can you expect? Who are we? Then we would like to give you an insight into our training. The aim of our training is to get you into practice straight away. Of course, you should be able to use ear acupuncture on animals immediately after the training. Now, to do this, you will need theoretical and practical instruction. We will introduce you to the material you will be working with and the nature of our practical instructions. At the end, you will receive a real takeaway for everyday practice. We will show you how you can get a dog or a horse into a state of deep relaxation with just a single point on the ear, either to anchor other therapy approaches or even make them possible in the first place, or to give the animal a phase of deep regeneration. Afterwards, we will have 50 minutes for you to ask any question you have on the topic. We are ready for you. And please post your questions in the chat so that we can answer them in order. What does the training we offer look like? Auriculo.org offers complete online trainings in human as well as in veterinary ear acupuncture. Meaning, you can organize your time freely, start whenever you want, interrupt the course and continue later, repeat parts and so on. The course is available to you for an indefinite period of time. Also, you will find all the necessary materials such as maps of veterinary ear acupuncture and a script in the form of our book as download. With the completion of the course, you will receive the qualification certificate Veterinary Auricular Therapist from the School for Auriculotherapy and Ear Acupuncture, Auriculo.org. Who is admitted? Now, we admit all animal therapists, meaning veterinarians, animal naturopaths, animal physiotherapists, animal osteopaths, and other types of enthusiastic animal practitioners. Now be aware that ear acupuncture is a completely independent, original therapeutic approach that has nothing to do with traditional Chinese acupuncture. If you decide to go this route, go to our website, Auriculo.org. Here you will find a column for veterinary therapists. As said before, our specialty is that we can teach you the full potential of this fantastic therapy method online. Now, if you would like to have it even more directly, or if you want a training tailored to your medical specialty, you can also get individual coaching. Here, you can find our online certification training, auriculotherapy, respectively ear acupuncture in dogs and horses. and a detailed description of what you can expect in this course. Now, the course is suitable for beginners as well as for therapists who already work with veterinary ear acupuncture. The latter will soon realize that they have only scratched the surface so far. We will now give you an insight into the course content and its material. Now we work on a very solid, unique foundation. And this is the original auriculotherapy according to Paul Nogier and his original maps, which we have transferred to the ear of the dog and the horse. Our book, Ear Acupuncture for Dogs and Horses, is the most comprehensive and precise work on the subject so far. It is also a kind of superscript for the course, in which you will find all the cards and point descriptions. You will get this book as an ebook with your course. You will not find a more precise and comprehensive basis for mastering this great therapy method. If you are interested just in the book to start with, you can order it via naturmed.de, they will ship worldwide, or via various laser pen manufacturers. In your course script, respectively, this ebook, you will find all the maps you will be working with, and of course, all the diagnostic and therapeutic techniques of veterinary ear acupuncture. Ear acupuncture, according to Paul Nogier, can be transferred from the human ear to the ears of dogs and horses once the homologous ear structures have been identified. For example, we will find the anthelix in the dog's ear here. The anthelix is the most important reference structure for the position of the musculoskeletal system in the ear. And this is the basis. If the homologue structures are known, the transfer to the animal ear can be carried out with high accuracy. And this is exactly what we have done, laying the most precise foundation for veterinary ear acupuncture. Now, in our online course, Ear Acupuncture on Dogs and Horses, we will not only show you the localization of the ear points and how to find them, but also all diagnostic and therapeutic methods on the animal ear. You will learn these techniques via demonstration videos. We now show you short clips from our demo videos, and this looks like this, for example. How do we treat at the animal's ear? Let's say with the technique of electrostimulation, and let's say at the point for the knee.
We can also electrostimulate ear points on animals. To do this, we have to get as close as possible to the skin with the tip of the electrode. We can do this by placing the tip transversely to the skin and then push it a little bit under the fur against the growth of the fur. When we're in position, we raise the electrode to a vertical position. Once we are in this position, we can start the therapy mode. In animals too, it makes sense to first make a complete diagnosis before we start therapy. In this way, we can better conclusions from the point distribution, and we can avoid getting distortions because we've already treated one or another point right after its detection. The disadvantage is, of course, that we have to remember the positions of the points we found, which is often not easy on the animal ear.
We will show you all possible treatment modalities. Another therapy technique is the use of laser pens, which are particularly suitable for ear acupuncture in animals.
Also, the Sedatelic Premio 32 Evo laser pen can be used on ears of animals. Different stimulation programs are available to us, depending on which pre-programmed Nogier frequency combinations we use. If we want to treat an area with the goal of pain relief, we would, for example, select the combination of frequencies E and G, which is the analgesia program. Of course, the individual Nogier frequencies are also available to us individually. To deliver 2.5 joules to the tissue, the dosage commonly used in human therapy to stimulate ear points, I have to run the laser pen for 30 seconds. The end of the stimulation time is indicated by a sound signal. In ear acupuncture in animals, we can increase the dosage up to 4 joules because the tissue is firmer and more muscular. I'm now showing you the treatment of the point I found before by detection.
We will also show you how to work with different devices of the same technique. Here, for example, another laser type, which is also suitable on animal ears. We can also use semi-permanent needles on the animal's ear. This would be yet another form of treatment that can be carried out individually or in combination with laser stimulation, for example.
We can also work on the animal ear with ASP semi-permanent needles. When we use them on humans, we aim at continuous stimulation. The needle remains in the tissue and usually falls out by itself after a few days. In animals, we want something different. We here want to stimulate for an auriculotherapeutic session. This is in animal rather difficult with conventional ear needles. So we replace these conventional needles with a semi-permanent needle. Also, we do not want the needle to remain permanently in the tissue and fall out again by itself after 5 days, for instance. It could fall into the food, into the hay, or even land in the ear channel. Therefore, we use the semi-permanent needle for one-time stimulation and remove it after the treatment after 20 minutes. When I have found a sensitive point with one of the diagnostic therapies, I disinfect the ear when I want to place the needle here at the point which I detected. I'm using here the knee point. I do not necessarily have to shave the area. Instead, I slide a needle under the fur and place it vertically on the skin with an abutment. I can quickly find it again by lightly combing the skin with my fingers afterwards. Here you see the little pinhead, and the needle remains in the skin now for 20 minutes.
And of course, we will also show you all the diagnostic procedures on the ear. The unique thing about the original ear acupuncture is that it is not just a therapeutic method, but also a very fine and precise diagnostic instrument. For example, is the cause of the lameness the knee or the ankle? Diagnostic indications are obtained by stimulating an ear point and simultaneously feeling the so-called RAC or the VAS or the Nogier pulse. We will show you how to do this. In this example here, Claudia uses a so-called 3-volt detector. Sensitive points will show up as a signal of the RAC or the Nogier pulse, which she then palpates at the dog's groin.
We can also use a 3-volt detector on the animal's ear. The zones are stimulated here with the help of a low voltage, and points that are in imbalance react stressed. This subliminal stress that the body experiences, I can feel with the help of the RAC. In humans, I usually feel the Nogier pulse on the radial artery. In the horse, I can test on the neck just below the angle of the jaw, where I can feel the carotid artery well. In dogs, I can test in the groin, where I can test well at the femoral artery. Another option is testing out the pulse by using my own pulse in the area of the temple or also at the carotid artery. In doing so, we make use of the experience that the subliminal stress reaction also shows itself in us, ourselves. That means in our system, which is close to the animal. Also with this method, we search the ear zone. At the same time, since I need both hands to examine the ear, at the same time my assistant touches the groin of the dog and feels the pulse. In the very moment when she gets a reaction, she says that she has the reaction, and I know that I have found a sensitive point. Again, we can easily reach under the fur with this detector. The angle at which we place the probe is not so important here. A weak current is giving via the probe tip. It is also important not to apply pressure on the tip in order to avoid distortions due to possible irritation. I'm starting here with the fossa triangularis. Here at the knee again. And as soon as I have a reaction, my patient signals this because she gets a pulse reaction at the same time. Pulse. In the knee area. Now we're further moving towards the hip. It doesn't seem to
Little
be
pulse.
Little pulse.
As you would expect, we demonstrate all techniques equally on the horse's ear. This is Claudia showing us how to work with semi-permanent needles on the horse's ear. Now, to speed things up, I did this demo with a voiceover. I will now show how I set an acupuncture needle on Lucky. There are different options here, different needles that we can use. Ordinary acupuncture needles or special ear acupuncture needles would be optimal, but they have the disadvantage that we cannot fix them so well in the skin of the animal. As soon as the animal shakes its head, the needles would fall out of the ear, at least that is very likely. But the needle must remain on the point for up to 20 minutes, and it is very unlikely that an animal will hold still that long. Now, this is why I use the semi-permanent needles. These are little tiny metal arrows that I can shoot into the point using a special applicator. This applicator comes together with the needle. So applicator and needle are one disposable instrument. They also don't go any deeper into the ear than a traditional acupuncture needle because the semi-permanent needles have a small abutment. After I place the needle, I leave it for 20 minutes and then I will take it out with tweezers. Now, a semi-permanent needle like this one that I'm using here can theoretically stay in the tissue longer. It would eventually fall out on its own. It wouldn't be able to do any harm like a conventional needle that gets on the floor or into the foot. But we basically want to rule out the possibility of any needle disappearing and perhaps being ingested with the food after all. For this reason, we remove the semi-permanent needle again and use it instead of a classical ear stimulation needle for about 20 minutes. Now first I disinfect the ear. Of course, not the whole ear, but only the area I want to stimulate. I use a disinfection spray and completely wet the area. I let this work for a short time and then I take the needle out of the blister. The horse now thinks he's getting something to eat, but unfortunately that's not the case. I can now run the needle again along the spot I selected earlier and see where the horse reacts. In this way, I can verify the point again very precisely in order to really be on the right spot. Now I place the needle vertically and shoot it into the tissue with the help of the applicator and with appropriate pressure. Horses put up with this quite well, even if you hit highly sensitive points. Now after 20 minutes I remove the needle again with the help of tweezers. If I want to treat points on the front of the ear, I'm also careful with semi-permanent needles. We don't want them to fall into the ear canal. In horses, if a needle falls out of the pinner, there's only one direction of fall, directly into the ear canal. That's why I prefer to use a laser for the front. In addition, lacquer is very hairy on the front side, which would generally make it difficult to place a needle. We have established that points on the front of the ear also need to be treated. And by the way, for laser stimulation, I now use the Nogier frequency C, which resonates with tissues of the musculoskeletal system. And that's what I have here, joint diseases. I am now lasering the point of the hip joint. The point is very sensitive, and of course, lacquer feels that immediately. Horses can get a little restless now, and it's good to have a helper there to hold the horse. I'm now also lasering the stifle joint and the fetlock joint on the inside of the ear. And here we finally notice that our patient has realized that everything is for his own good. Now, is veterinary ear acupuncture a complex matter? Well, yes. It is complex and at the same time so simple. How can that be? Well, ear acupuncture is complex because the body is complex and all body structures are reflected in the ear. Not only the musculoskeletal system, the internal organs and the blood vessels, but also the entire nervous system, including the smallest structures of the central nervous system, and therefore also, for example, the entire hormonal control of the body. And this gives us reflex access to all body structures, both diagnostically and therapeutically. This is something so extraordinary that it takes time to really realize it. At the same time, ear acupuncture is simple because once you have oriented yourself to the ear, you can use this orientation to scan the body like an X-ray machine. You can obtain diagnostic information in a very simple way. How far we go with this does not depend on the ear, but on our knowledge of the body's interconnections. So we can concentrate only on the musculoskeletal system, for example, because we want to know which joint is most severely disturbed. However, we can also differentiate in the case of paralysis whether we have a central cause or not. The more in-depth our knowledge of body anatomy and pathology, the more finely we can recognize the information we receive via the ear. Most animal physiotherapists, for example, use ear acupuncture to diagnose and treat disorders of the musculoskeletal system. And this alone is an incredible treasure and is super quick to learn. And if they want, they can always go deeper later. And in addition, there are simple universal therapeutic approaches on the ear. For example, points that can be used to relieve pain. We can use these regardless of the location and cause of the pain. Or there are zones or points with which we can induce deep relaxation, points with which we can exert a positive influence on behavioral disorders such as aggression or anxiety, and so on. Now, the tools for an auricular therapist include good, valid ear maps, and secondly, knowledge of the possible diagnostic and therapeutic techniques. He or she can then take his or her time and slowly conquer this exciting field while immediately having direct, simple, and unrivaled treatment options for the everyday practice. To sum this up, the potential of ear acupuncture in terms of diagnosis and therapy is inexhaustible. At the same time, there is hardly any comparable approach that can be used so quickly and directly for animal welfare, even for beginners. Having this said, we still have another question. Is ear acupuncture complicated to perform on animals? Do the animals accept it? Now, it is true that it is more difficult to work on the front of the ear in animals than in humans. Horses, in particular, are very sensitive here. They often don't like it when we reach deep into the ear funnel to look for points. On the other hand, we have an invaluable advantage, namely the strongly pronounced, extended, large backside of the ear, on which all body structures are equally and even more extensively represented. 90% of the structures can be reached from the inside as well as the outside of the ear. And if we stimulate here, let's say the stomach area, in the case of gastritis, for example, and let's say with a laser pen whose light also reaches the other side, the front, then we can optimally treat every area and every point. Now, the mirror image zones on the back of the ear also originate from Paul Nogier himself. They carry other aspects of one and the same structure. And with our therapy approach, we are able to reach both of these aspects at the same time. Our course is designed to allow you to progress according to your focus and current interest. When you start our online course, Ear Acupuncture for Dogs and Horses, you will find a PDF with the title Course Navigator in the download area. And here you will find an overview of the various course modules. There are 9 of them altogether. In the main modules, we discuss the representation of the different body systems in the ear. So, the musculoskeletal system, the internal organs, plus the endocrine system and the circulatory system, and the nervous system. Now, for each body system, we will show you how to find the corresponding structures. That's the localization. Then how to make a diagnosis and how to perform treatment. For each body system, there are also so-called functional points. and these always have a therapeutic effect. Now, of course, we will also show you these, and then we will look at typical indications for which ear acupuncture can be used and examples of typical zones and points that we would treat. So these are the main modules organized by body system. And with the help of 4 supplementary modules, complements, you will learn which diagnostic and therapeutic techniques are available to us as veterinary auricular therapists. The first complementary module explains and demonstrates all simple therapeutic and diagnostic procedures. The second supplementary module deals with the so-called RAC, that is the reflex auriculocardiac, or also called the VAS, the autonomic vascular system, or also it's called the Nogier pulse. And this is a subjective technique that allows us to detect interferences in the body via the ear. This technique for ear diagnosis is not absolutely necessary for us. That is why we have not included it in the first complement. Even many human ear acupuncturists are not even aware of this possibility. But sooner or later you will be interested, because this diagnostic technique will take us light years forward, and you can tap into this element when you are ready. It's not going anywhere. Then there is the third supplementary module, which summarizes the therapeutic rules from which our therapy instructions are derived and which we refer to again and again in specific cases. This would be a supplement that should be looked at quite soon, for example, so that questions that are sure to arise in the course can be clarified straight away. The fourth complementary module is about the so-called Nogier frequencies. Paul Nogier used therapeutic frequencies to optimize the therapeutic effects of ear acupuncture. These are the famous 7 Nogier frequencies, which correspond to 7 clearly defined zones at the ear. Each of these 7 ear fields has its own frequency signature, and these frequencies are another therapy option. You don't have to use them, but you can use them. And here the same. Should this interest you, sooner or later, you have the compass for how to use these frequencies in your course included. So this allows you to tailor your course to your focus and interests. Do you want to quickly recognize and treat musculoskeletal disorders? Then take the first module and the first complement module. The sooner you get into practice, the better. And once you have some experience and thus confidence, you can move forward. One last comment about the 2 intro modules. Here we show how Paul Nogier developed ear acupuncture, and this is incredibly exciting and interesting, because if you understand this, you have a thoroughly organic, living approach to diagnosis and therapy on the ear. The system opens up to us from within. It is then neither abstract nor technical, but so vital to the highest degree. We also offer individual online tutoring. If you want to learn one-to-one from the start, or in the form of a small group, for example, or if you have specific questions or want to discuss cases in the course of your practice. Or if you have a treatment specialty, a special medical field that you would like to enrich with ear acupuncture. In all these cases, just please contact Claudia Loyal via loyal@tonline.de. Finally, as promised, we would like to show you 2 super simple therapeutic approaches that you can implement immediately. This here is the so-called 0 point at the back of the ear. If you look at the ear, here obviously on a horse, so if you look here from behind, you will find the dividing line between the ear and the head. That is the area where the ear attaches to the head. And then you will find 2 elevations above it, one bulging outward and the other one going inward, so towards the middle. And here there is a depression in the middle of the attachment line between these 2 protrusions that you cannot miss. And this is the 0 point. It is a universal control point for the ear. It is also the master point for all internal organs. If you stimulate this point, you can balance physical and mental imbalances, very roughly speaking. So your patient will go into relaxation, let go, and find a state of regeneration. Now let's take a look at our candidate here. This guy here got the treatment of the 0 point. And did already go downward. And you can then, for example, use this opportunity for palpation of the ear. To get acquainted with all ear structures. The ear funnel, which goes deep down. The horse will allow this because it's very relaxed now. And likes this kind of massage so much. The area of the antetragus. So, our candidate here is so very far away, almost in a state of trance, and did lie down.
Jetzt pennt er schon wieder ein.
And you even can, of course, stimulate this point manually if you don't have a laser yet. Just try this treatment and get acquainted with the ear. Yes, and even later he's still in a state of trance and super deeply relaxed. Another very simple treatment approach is the stimulation of the so-called tragal area, the area of the tragus. This little bump here, that is the tragus. And the tragus houses important control zones for the whole body. The area is part of the central nervous system. Stimulation of the tragus has long been known for its positive strengthening effect on the vagal system. Here we can stabilize the parasympathetic nervous system, which is a prerequisite for regeneration processes to take place. Nervous, anxious patients, patients with emotional control problems and nervous disorders, patients with intestinal or respiratory problems, and even patients with a weakened immune system will benefit from this so simple therapeutic technique. Now, this candidate here, for example, couldn't get enough and even left his full feeding bowl just for a vagus stimulation.
Will mehr. Das ist unglaublich.
Just try this once, and this will give you your first experience of the significant impact that treatment via the ear can achieve.
Also hat Fressen in der Box, Heu auch. Er geht da nicht hin, er kommt immer wieder zu mir und er will hier echt Nachschlag. Mein Schatz. Alles gut. Ja, er holt es sich echt ab, ne? Kinders, ich kann es nicht anders sagen. Er holt es sich echt hier ab.
We are at the end of our info webinar and we wish all animal therapists the very best of success. And are now ready to answer your questions.